Hello, everyone. Welcome to my this session of the micro teaching homework. I know we during the class we picked cochlear implants for the topic, so I'm gonna use around 10 minutes to talk about it. To talk about some information I searched from online, and I'll use English version first, then I'll interpret it into Mandarin for every people to understand. So to begin with, the cochlear implants are small electronic devices that help people to hear sounds. Basically, is for the hearing impaired persons. They are for people who have the moderate to profound hearing loss. Basically, the cochlear implants has two main parts to work with. The one part is the outside of the ear, so it has a microphone actually to detect sound, a battery to make it work, to power the system, and a processor to process sound, and the transmitter to send the electronic signals into the internal part. And the cochlear implant's internal part is implanted actually under the skin with electrodes, actually is wires that extend into the cochlear, into the inner ear, which is a very important structure inside in the inner ear part. The electrodes respond to sound information captured by the outer processor, and it stimulates the neurons in the cochlear to create a signal that is picked up by the brain, by the nerves. So you may also curious about how is cochlear implant inserted. Actually, it's not a very complicated surgery. It actually is outpatient procedure. It's a day surgery performed in a hospital or a clinic. So with the patient under general anesthesia, we put the patient to sleep. The surgeon, the ENT surgeon, actually will make a small incision behind the ear, and he or she places the internal processor under the skin. And then the doctor will drilling a small hole and to gain access to the inner ear, and places the electrodes inside the cochlear. And altogether, the process is maybe approximately 2 or 3 hours long. And about 3 to 4 weeks after the surgery, so when the patient is perfectly healed, the audiologist will activate the cochlear implants external parts, which starts electronical stimulation and a new hearing experience for the patient. So who is candidate for the cochlear implant? So the cochlear implants are designed for people with moderate to severe hearing loss. So who has difficulty interpreting speech, even with a hearing aid. So children whose hearing loss is not adequately managed with hearing aids can benefit from cochlear implants maybe. So when using starting at a young age, cochlear implants can improve a child's hearing and ability to understand and the way they use and learn language to spoken language actually. So the results for people with cochlear implant will actually it differ widely from little benefit to almost completely restored hearing. And for adults, the hearing improves rapidly during the first 3 months, and then the levels off. So with a slower improvements over the next several years, he may get a very stable hearing level. And progress is slower for children, actually. They need to learn language through hearing with the cochlear implants. They need time to adopt the surgery, adopt the instruments. So most people can distinguish soft, medium, or loud noises, and they can identify common sounds such as the doorbell, the phone, and approaching vehicles or people, footsteps. And many people can use telephone and watch and enjoy television actually. And some people who have exceptionally good results, they can hear and appreciate music with or without the headphones, and then even discern the different instruments. And all current cochlear implants, which is very smart, they can wirelessly stream audio, stream music from the smartphones and other devices equipped with Bluetooth. So it will make people to hear music as a normal hearing function people. And this is a big difference between cochlear implant and a hearing aid, which by wearing a hearing aid, they're just a sound amplifier. So people cannot enjoy music through headphones. And 下面我用普通话再给大家解释一遍。这个人工耳蜗呢，我们说它是帮助人们听到声音的一个小型的电子设备，用电池供应的。它基本上是适用于中度到重度听力损失的人。这个人工耳蜗呢，主要有两个部分。在使用的时候，它就有两个部分，一部分它位于耳朵之外，它有一个用于检测声音的麦克风，一个为系统供电的一个电池，还有一个处理声音的处理器，以及呢，它有一个将电信号发送到内部这个部件的一个发射器，一个电线其实是。然后这个内部部分呢是植入皮下的，它实际上是通过电极连接到中耳里面的耳蜗里面。这个电极呢对外部的声音的捕获和处理，通过传导到这个内部的一个配件，它直接刺激耳蜗中的这个中耳的神经元，让大脑接收这个信号，患者就可以听见了。那么，我们比较关心的是如何在植入这个人工耳蜗。听上去很恐怖，但实际上它这个手术实际上是一个在医院或诊所进行的门诊手术，当天就可以回家。患者要在全身麻醉，也就是全麻睡眠的情况下进行的。外科医生呢，也就是咱们说这个耳鼻喉科 ENT 的医生，他在耳朵后面做一个小切口，先把这个外部的部件处理器放置在皮肤下面，然后再继续呢钻一个小孔，通过这个小孔达到中耳，把这个电极，也就是刺激传导器放在里面，放在耳蜗接触的地方。整个过程大约需要2到3个小时就可以结束了。那么手术之后呢，大约3到4个星期，患者在完全恢复以后，那么就有听力专家将激活这个人工耳蜗的外部部件，从而开始这个电刺激，并且为患者呢带来新的听力体验。咱们说谁可以植入这个人工耳蜗呢？人工耳蜗它是专门为患有这个中度到重度，刚才咱们讲过嘛，这个听力神经损害的人而设计的。那么这些人呢，即使使用助听器，他也听不到，或者说难以这个纠正他的这个听力损失。而且尤其是对于儿童来讲，他可以从人工耳蜗中获益非常大。他从很小的时候开始使用，那么人工耳蜗可以帮助他对声音的一个学习、一个模仿，然后可以很大程度的促进他对语言的一个发育发展。对于成年人哈，他置入这个人工耳蜗的这个结果来说，差异很大。有的时候置入人工耳蜗也没有什么听力的改善，但有的好处呢，可以是有的人效果很好的话，他的听力可以达到几乎完全的恢复。成年人呢，他在前3个月以内迅速的改善听力以后，达到一个平稳的状态。那么接下来的几年中呢，他改善的速度会越来越缓慢。但是对于儿童来讲呢，他一开始的时候可能进步会很慢，因为他们本来什么都听不见嘛，他们需要戴上这个人工耳蜗之后，从头开始学习语言，他可能就比语言敏感期的小孩子学习语言的时间已经退后了。所以他们可能刚刚戴上人工耳蜗开始的时候，这个从能听到东西再学习，他的语言可能进步，就是听力的进步可能会相对慢一点。大多数人呢，戴上人工耳蜗以后，可以区分这个轻柔的、中度的或者是很大声的声音。他们可以识别常见的声音，比如说像门铃啊、电话呀，还有接近的汽车啊、车子啊、脚步声啊等等。很多人呢还可以用它打电话啊，或者是观看电视、欣赏音乐都可以的。如果恢复的很好的话，还可以那这个辨别不同的乐器，这个不同乐器的这个声音都可以听出来。目前来讲，很好的一个 智能的发展是，所有的人工耳蜗都可以从这个智能手机连接到配备蓝牙的一个设备进行无线传输的音频，他们也就能像正常人一样，能够做到打电话的时候传输一个声音，然后听音乐的时候传输一个声音，还可以我做过几次，就是帮患者去激活，然后调节这个人工耳蜗的一些预约。患者都是如果他不讲话的话，头发盖住，完全看不出来是佩戴人工耳蜗的患者。他也可以就是通过调节外部的声音，环境音大或者小，或者是连接到蓝牙上面直接欣赏音乐呀、看球赛啊这些，都没有问题的。所以现在这个智能的技术的发展，对这些患者的听力的恢复还是非常有效的。